Howdy! Welcome to our presentation. Today, we will be discussing a very concerning issue in the nursing workplace. Our presentation is about bullying and horizontal incivility. This issue is especially concerning as we are soon going to graduate and join the workforce as new nurses. Presenting today is
Alessandra Good,
Amanda Gossett,
Frances Hodap, Shelley Horrock,
and Zachary Miller.
After viewing our presentation, students will be able to define horizontal incivility/bullying in the workplace, describe the prevalence of horizontal incivility in the workplace, identify potential causes of horizontal incivility/bullying among nurses, examine the potential reasons for underreporting of horizontal incivility, discuss the cultural implication of horizontal incivility in the workplace, describe the relevance of bullying to clinical practice and role as a nurse, discuss policies that exist to address bullying in the workplace, examine some of the physical, psychological, and financial consequences that result from the presence of bullying in the workplace.
Horizontal incivility has many terms, including horizontal violence, bullying in nursing, workplace incivility, and lateral violence. Horizontal incivility is the deliberate and destructive behavior that one employee can have towards another employee. In the healthcare workplaces, this can commonly occur among nurses where one nurse is deliberately hostile or violent towards another nurse. These acts of aggression can occur over a period of time, going unreported or unrecognized. There are many ways that nurses may perform violent acts of aggression towards other nurses. Horizontal incivility can be verbal, physical, or psychological, and it is important to recognize these acts of aggression. Verbal acts of violence can include belittling language, offensive comments, hostile words, sexual comments, and other verbal assaults. Physical acts of violence can include sexual assault or other forms of physical aggression. Psychological acts of violence may include attacking another nurse's reputation, blaming a nurse in front of patients or families, making faces in response to another nurse, withholding information from that nurse that may cause them harm, gossiping about another nurse, or breaking their trust. There are other forms of horizontal incivility that are not mentioned that may cause unwanted harm to another person.
A new nurse who worked so hard to achieve entering this profession often find their welcoming into this new career to be something less than hospitable. Tenured nursing staff are experiencing a high level of stress with increased workloads and responsibilities, so the appearance of training a recently graduated nurse represents an additional task they will be expected to fulfill. While this may appear to be a relatively new issue in the nursing profession, in actuality, this has been a professional concern for over 30 years. The question of whether or not nurses eat their young was first posed by Judith Meisner in 1986. Unfortunately, this question has become a common idiom and remains relevant in today's nursing culture.
According to the Occupational Safety and Health Administration, there was a health risk appraisal survey of 3,765 registered nurses and nursing students conducted by the American Nurses Association in 2015. Within a 12-month time frame, this survey found that 21% of these respondents were physically assaulted, and over 50% of these people were verbally mistreated. According to the Occupational Safety and Health Administration, There was a survey conducted by the Emergency Nurses Association in 2009 through 2011 of 7,169 nurses in a 7-day time frame. Of these nurses, 12% of them in the emergency department were affected by physical abuse, and 59% were verbally assaulted. According to the Occupational Safety and Health Administration, another survey was conducted in 2002 at the Veterans Health Administration hospitals. The survey consisted of 72,349 healthcare workers, and 13% of these workers were assaulted. According to these statistics, horizontal incivility occurs in the workplace among nurses, and it is important to address this issue in order to find solutions to this problem.
There are several potential causes of bullying in the workplace. One of the potential causes of bullying is the oppression of nurses related to the long-standing paternalism in healthcare. Although nurses have been taught that physicians are partners in healthcare and to advocate for patients, there are still physicians that desire to have power over nurses. This oppression of nurses caused them to feel powerless and turn their frustration to other members of their group, especially those who they perceive to be less powerful, such as new graduate nurses. Another cause of bullying is authoritarian management practices. In this style of leadership, the manager enforces strict rules and closely controls the employees. Employees pick up on these confrontational practices, which contributes to their display of aggression. Lastly, the nursing culture may influence bullying. Nurses may be socialized to practice bullying behaviors and learn this behavior from other nurses. Nurses become encultured to bully each other, especially when they experience this bullying in school and early on in their jobs. This bullying behavior becomes culturally normalized if bullying goes unchecked by nurse managers and other work members. Nurses and nurse managers who are not assertive when bullying contribute to this culture of lateral violence.
There are several reasons why bullying is often underreported. One of the reasons is the culture of acceptance. As stated in the last slide, bullying is a learned behavior. If nurses are part of a healthcare team where bullying is present and left unchecked by management, then that behavior starts to become the cultural norm, and this behavior may start to be viewed as acceptable. Additionally, bullying may be underreported due to a lack of trust in management. Nurses who do not feel valued or respected may contribute to lateral violence. If the nurse does not believe their concerns will be respected or that anything will be done about their concerns, then they will become less likely to report bullying. Another reason for underreporting may be due to fear of retaliation. Nobody wants to be labeled as a snitch and ultimately scrutinized by their fellow coworkers. And lastly, nurses may be embarrassed about their situation and do not want to report the lateral violence. No grown adult wants to admit that they're being bullied because that's kind of embarrassing, and so they just leave it unchecked. So what are some of the consequences of bullying in the workplace? Well, bullying in the workplace can create detrimental consequences to the organization and the people who are affected by it. Multiple studies have determined that many healthcare workplaces possess negative environments that foster disrespectful attitudes, inappropriate behaviors, and bullying. Based on a study by Wright and Kotry, lateral violence in the workplace may result in medical errors, decreased communication, low morale, reduced collaborative behaviors, and stress. These bullying behaviors are also found to cause problems including negative psychological and behavioral responses, decreased quality of care to patients, declining hospital reputation, financial costs, and decreased retention rates, which means that the nurses aren't staying in the hospital, they're moving on to other opportunities. The psychological and behavioral consequences of horizontal incivility include anxiety and depression, and this anxiety and depression may lead to underperformance, professional disengagement, and ultimately poor job satisfaction. The physical consequences of bullying may include diminished quality of care for patients, and this diminished quality of care can alter the patient's as well as the family's perception of the hospital, which may lead to a poor hospital reputation. Another consequence of bullying in the workplace is the financial costs. According to Lindy and Schaefer, costs related to bullying are caused by increased turnover of nurses, decreased productivity, diminished quality of work, and increased absenteeism. A study estimated that the average cost of bullying per victim can range from $30,000 to $100,000. According to the Joint Commission, they found that the cost of replacing a registered nurse may range from anywhere from $27,000 to $103,000.
The consequences mentioned previously have huge implications in the nursing practice. Here, we will discuss some of the consequences previously mentioned, as well as a few others more in depth. Bullying and incivility plays a huge part in our everyday lives as nurses. According to Hamlin et al., violence and incivility between hospital employees can contribute to turnover of top performers, hinder effective teamwork, and jeopardize the quality of patient care. This shows that bullying not only affects us personally, but our coworkers and our patients as well. In regards to patient care, we have all been taught throughout nursing school that teamwork and communication are absolutely critical when it comes to the welfare and safety of our patients. Just as it takes a village to raise a child, it takes a team to heal a patient. However, work incivility reduces team productivity and efficiency. Additionally, it can also hinder communication amongst health team members and isolate individual workers. As we can see, incivility weakens all of the healthcare team, communication, and ultimately our patients. Bullying or incivility may also hinder the confidence of nurses and impact patient care by creating fear of performing needed interventions due to the feeling of incompetence. Furthermore, bullies often tend to harass those whose confidence may already be compromised. This only tends to complicate the issue further. This culture of incivility in nursing does not help with the known nursing shortage in our country. Yugis and Lingnung examined the impact of horizontal incivility on the nursing shortage and addresses that the culture may drive prospective nurses away from the profession, as well as impact retention rates. This, in turn, leaves remaining nurses with an increased workload and increased patient-to-nurse ratio. What is worse, according to Hamlin et al., is that high workload was found to be a catalyst for worker-to-worker conflict based on the stress of having too many job demands, such as the number of tasks paired with low resources or limited time. As one can imagine, this can turn incivility into a cyclic process. Ultimately, bullying or incivility in the workplace can be detrimental to nurses, patients, and healthcare teams as a whole. Not only is it extremely hurtful and can create safety issues, it is also just plain counterproductive. This counterproductivity not only takes time out of the patient care by disrupting work tasks, it also requires time on the part of the reporter by having to file incident reports. So, what can we do to end it? We've spoken now about the consequences of workplace incivility, so what can we do to stop it? There is a number of different ways we can begin to address this issue, and here we will discuss a few. For starters, because incivility can cause so much undue harm to teams, it is essential that we, as healthcare workers, place a lot of value on teamwork. According to Logan 2016, by emphasizing teamwork, focusing on essential team variables, and ensuring effective training programs, workplace incivility will likely diminish, and nurses will be better equipped to effectively manage their high-demand careers. This would also, in turn, benefit the healthcare team as a whole. Additionally, it's imperative that nurses be proactive
and reactive to bullying by advocating to put an end to the culture of workplace and horizontal incivility. Not only must nurses do this by setting good examples themselves, they must also participate and advocate to have education on prevention or cessation of this issue readily available to themselves and their fellow nurses. Education involving case study, role play, and discussion about horizontal violence in the workplace is an effective way to share information about strategies that can help in bullying in nursing. Another method we can use to limit horizontal incivility in the workplace is to be clear and concise in our communication about it. In order to do this, we must first be self-reflective to analyze our own role and behavior in the situation and respectfully pass along any concerns or complaints to the appropriate professional. Whether we are trying to solve a debate concerning a clinical issue effectively or address a bullying behavior head-on, it is essential that we communicate with our own beliefs, the perpetrator, and up the chain of command as necessary. Without communicating, people may not even be aware they are participating in workplace incivility. Finally, we speak about preventing workplace incivility through maintaining a zero-tolerance environment. According to Hamlin et al., maintaining a strict code of behavior and consistently reviewing problem behaviors reinforce a more positive work climate for employee safety and well-being, as well as more positive care environment for the patients. While many nursing managers begin to implement a zero-tolerance environment while interviewing new nurses via a screening process, it is up to every nurse to help maintain a zero-tolerance environment.
There is no one universal policy for bullying, but one of the closest is a standard implemented by the Joint Commission called Zero Tolerance. In 2008, the Joint Commission updated its leadership standards for any establishment seeking accreditation. These standards required that hospitals needed to clarify exactly what they establish bullying to be in their establishment, so that everyone would be aware of what was acceptable and what was not acceptable. Secondly, they required the hospitals to have a plan of action to deal with the incidents as they arose, specifically how they were confronted, reported, managed, and disciplined. Requiring these standards was an important milestone in calling attention to the reality and commonality of horizontal violence. With this policy, each hospital or facility determines their own guidelines concerning how horizontal incivility is defined, the specifics on how to deal with it, and the resources nurses have available to them. Some of the resources can include anonymous reporting, which can help eliminate the fear of repercussion that deters some nurses from speaking up. Focus groups and educational classes can also encourage safe places to bring up issues experienced or witnessed, while also providing an opportunity for bullying education. The continuing education classes are especially important for a facility that has ongoing bullying issues that may become part of their work culture. Periodic education and focus groups serves as reminders that bullying does not have to be tolerated. No matter what kind of policies are in place or what kind of resources are available, none will be effective in decreasing bullying if they are not used and used consistently and equally for all staff members. Everyone should be held accountable for modeling no tolerance and reporting any signs of bullying in the workplace to promote a healthy and constructive working environment.
Here are the references we used for this presentation. We hope that you gained more knowledge about this issue in the workplace and are more aware of the consequences of horizontal incivility. It is a prevalent issue that needs to be addressed, and we appreciate you taking the time to learn about it.